Y'all hear that?
Time to wake up.
I try to keep my phone real silent.
Kelly, can we have like a new person in charge of diversion programs?
We'll call to order the meeting for roll call. Does everyone want to introduce themselves?
Kelly Basie from the DA's office.
Ryan Bond.
Rick Warren.
Cat Bridge. Jim Anderson from Sheriff's Office.
Notice of this meeting was properly posted on March 20th, 2024. I'll take a motion for approval of the minutes from September 7th, 2023.
So moved.
Second.
Discussion and, to vote.
All in favor?
All in favor?
Aye.
All opposed? Passes. And then moving to discussion and possible action regarding the election of chairman and vice chairman for 2024.
Do we take nominations at this time? Chairperson, is that what you would like to do?
Yes.
I would nominate Bridget Biffle to stand in place of, for the Public Defender's Office as the chairman, and Ms. Behenna to stay as vice chairman, as it was.
This one is Judge Stoner.
Oh, Judge Stoner, and keep Judge Stoner as vice
I
chairman.
think he's revealed that he can't be here.
Yeah.
So that's why he's no longer here, because it conflicts with some on his docket.
Oh, that's right.
Presiding hasn't named a new judge to come to these meetings yet, but I don't think we'll anticipate seeing Mr. Stoner anymore.
You keep it easy if it's Ms. Behenna. She's on the other ones right now, so I'll make that motion that the chair would be Bridget Biffle and the vice chair would be Vicky Behenna.
Yeah, second.
Second.
All in favor?
Aye.
All opposed? Okay, passes. And then discussion and possible action regarding the Oklahoma County Court Services Bureau monthly statistics reports.
Good afternoon, everybody. We have several months to go through, so we got about 6 months to do here. So if it's okay, I'll go over the top points while you guys are looking at each month, if that's okay. So we'll start with September. So pretrial release without conditions, OR. There were 55 that qualified, 46 that were approved, so that's a good month, only 9 denied. We served 324 with 16 that failed to appear. With conditions, so our conditional bond, 31 were presented to judges with 15 of those approved. 170 served with 6 that failed to appear. And any questions on September, I'll be happy to answer. Alright, we can go to October. Okay, without conditions, 58 qualified, 54 approved, which is great. 329 served with 9 that failed to appear. With conditions, conditional bond, 36 presented with 12 approved. So about 24 denied that month. Served 172 with 8 that failed to appear. That was October. November, we have 63 that qualified without conditions, with 50 of those being approved. 324 served with 11 that failed to appear. With conditions, 38 presented to the judges with 19 of those being approved. 181 served with 4 that failed to appear.
I just have a tiny
Sure.
question. When there's no conditions, what do you do?
Well, yeah, it's called no conditions or OR. We still stay in contact with them regularly. We remind them of their court dates. They'll call in also with any status changes, status updates. So they don't have conditions, but I guess if you call that a condition, sort of, where we stay in contact with them and message them and phone calls to make sure they're showing up for court. Are we going to December?
Mm-hmm.
Okay, so for without conditions, 17 qualified with 12 approved, 282 served, 10 failed to appear. And then with conditions, 44 presented with 25 approved. Let's see, 188 served with 2 that failed to appear. We're getting there. Okay, January. Let's see, without conditions, 28 were qualified with 19 approved, 295 served, 12 FTAs. And with conditions, 44 presented to the courts with 20 that were approved, 24 denied, 188 supervised for the month, and 3 that failed to appear. And last, February, we have, let's see, without conditions, 59 that qualified with 46 approved, 321 served with 6 that failed to appear. With conditions, 49 presented to the judges with 28 approved, 196 supervised, and 4 that failed to appear.
I move to accept those reports as given.
Second.
All in favor?
Aye.
All opposed? And then on to discussion and possible action regarding the Oklahoma County Court Services judicial statistics reports.
We'll start with September, and as you know, these are the same numbers that you just saw, just broken down by judge. So you'll see September 2023 is the first one where, again, it's the same numbers, but you'll be able to see the activity for the month. Oh, I'm good.
Would you all like me to go through them all?
We have them on our attachments.
Yeah.
Unless somebody wants individual consideration, I'll move them. Here's thinking.
Second.
All in favor?
Aye.
All opposed? And then moving on to discussion and possible action regarding the potential implementation of an evidence-based risk assessment tool as recommended by Crime and Justice Institute.
Okay, so as most of you, I think all of you were probably there at the last CJAC subcommittee. I gave a presentation on this, and there was quite a big discussion with it. And so I've had this on here for the last few meetings, so we finally get a chance to talk about this. So as you know, how we got here was from CJI's report. And from NAMSA, the National Association of Pretrial Services Agencies, any group recommends a validated risk assessment tool. And that's been happening for years. And if you remember in here, we discussed the Ohio risk assessment pretrial tool for here, and it didn't get any teeth. And that's fine. And so I contacted CJI and I spoke to Molly, who did the report, and I asked specifically, okay, for a validated risk assessment tool, which ones? You tell us which ones you suggest. And there's only 2 that she suggested, the Ohio, the ORAS, and this one, the public safety assessment. And based on that conversation, she feels that the PSA is the newest one, the better one, the one that more and more agencies are using and they like. So I brought that here today to discuss that. Really, the main point is to see your thoughts and if there's anything behind it and if we want to go forward. If we want to go forward with switching and using a validated risk assessment tool, then it'd be up to you, but maybe my suggestion would be forming a smaller committee or obviously getting Judge Ogden involved and some others and sitting down and really looking at it. Because I had several meetings with Jessica Ireland. She's with the Center for Effective Public Policy, and she's technically the expert for this PSA. And she's really good, and she can explain it really well. So it may serve us better to do that, because it is at least a 6-month process. So if we decided today, yes, do it, it's about at least 6 months to actually implement it. And so just as a reminder, I'll just briefly give you the PSA, what it is. So it focuses on 2 things. It estimates the likelihood that someone will appear in court, and it estimates the likelihood that they will remain arrest-free. They use 9 factors to generate 3 outcomes. Okay, and just real quick, I'll tell you what those factors are. Age at current arrest, current violent offense, pending charge at time of arrest, prior misdemeanor convictions, prior felony convictions, prior violent convictions, prior FTA in the past 2 years, prior FTA older than 2 years, and prior sentence of incarceration. So they take those 9 factors and you basically get a score. And then based on that score, there's a matrix that can be created, and it's all tailor-made. All this stuff is tailor-made. It's not exact to your county what best fits you. And based on that score, you can implement what you feel the best course of action is for this person if they're released pretrial. Do they need no supervision, no anything, and just, an OR status? Do they need an ankle monitor and high supervision, high needs, that sort of stuff? It just puts it on a diagram, and then it's fact-based, and you give that to the judge, and the judge bases their decision on that.
So on that grid,
Uh-huh.
when you have certain factors, like I started my crime, started committing crimes at 14, and those factors that you said, it goes on a grid and then it spits out a suggestion.
It spits out a number. It's a score,
Okay, that's
right?
the
And so
score.
it's basically a fact-based system, right? And so we use NCIC. We have NCIC access. We do the background. All these things are really fact-based. Now the PSA does not require an interview, which we do an interview now, and per NAPSA best practices, they highly suggest doing an interview because you can learn a lot on someone in an interview and maybe additional needs they may need to pre-plan. So I would highly suggest an interview. It's not necessarily, but most definitely would want to. But no, you take that fact-based information and you input a score really,
Yeah.
and you get a score. And then that score falls on this matrix, and it tells
And then
you
it tells you what
what-
a suggestion, what the judge should put as a condition or no condition.
correct.
And we haven't talked to Judge Ogden at all. I like that idea,
So yeah, he was at the subcommittee, so
Right.
he got the presentation.
but not lining the subcommittee.
No, I would highly suggest we do that. I can go do that individually and sit with him and see what he thinks, or we can do a smaller committee. I'm open to doing whatever, but just know that the potential to implement a validated risk assessment tool is suggested and always recommended by any group that you come across. So I just wanted to bring that to you today to get your thoughts.
I'm gonna make a motion to table this so we can get some more information on potential subcommittee and go for that more.
Sure. Do you want to form the subcommittee or just wait and we can talk and come up with something? Whatever.
Form a subcommittee.
Yeah, we can go ahead and form it to get started on it.
Okay, so I mean,
Can we
obviously,
form it outside of here? Like you could get with us and see who all wants to be
Okay.
involved in the meeting, really it's a meeting with Ogden.
perfect.
So maybe move to have the subcommittee together for our next meeting. We can independently or in
Yeah.
groups get together and form our committee, and then we can introduce our suggested subcommittee at the next meeting.
Second that.
Sorry, so back up for just a second. So you made a motion to table, do you mean to take it up later today or to defer it to next time?
I think we can defer it to next time, and then talk about the subcommittee getting together and how we wanna do that.
Okay, perfect. And then do we have a second
So I
for
second
that?
that motion.
Okay.
And I unsecond that motion.
Okay.
All in favor?
Uh,
All opposed? Okay,
And then,
motion passes.
okay, and then we had another one, thank you for that,
to be sufficiently motivated such that at the next meeting, we have a proposed subcommittee that we can vote on at that time.
Is that consistent with the first one?
Are you wanting to wait till next meeting to form a subcommittee? Is that what you're saying?
Well, I think we have to approve the subcommittee. And so my motion is for us to be ready to approve a proposed subcommittee at the next meeting.
I think like you tabled it, that kind of contradicts each
So
other.
adopt it. Okay, well then I'll withdraw my motion.
Can you withdraw your second? Yes, ma'am.
Okay, thank you. And then any citizen participation?
I think we have one more.
Number 6, discussion and possible action regarding the mandatory exclusionary crimes list and to consider any amendments to expand eligibility for pretrial release as recommended by the Crime and Justice Institute.
Okay, so same thing as the last item is how we got here today was the same way through CJI. And one of their recommendations is to expand the eligibility for folks to be approved for pretrial release. And that's what we're here for, right? We're here to lower the jail population and help these people get to court and, you know, and do good and move on. One of the only things, other than the folks that are denied a pretrial release by the courts, which is fine, that information is provided and we stand by those judges and their decisions, is the mandatory exclusionary crimes list. And that is the only thing that stops eligibility. Anybody on that mandatory exclusionary crimes list cannot get out of jail. And so I'm not suggesting we do away with it. I'm not suggesting we add to it, subtract to it, amend it. I'm here to, again, like the validated risk assessment tool, get your thoughts on if that should be the case. Could you open that up? So there's a list right there. So this was created back in 2008 and approved by the Board of County Commissioners with the presiding judge. And just so you know how this works is if you're booked in to county jail and you have any of these 21 on there, then we do not work that person up and deliver that paperwork to a judge for release. It's been agreed that these crimes are too serious for us to deliver that paperwork. However, at the same time, and it happens in many instances, where it's agreed in court through an order by the judge to release them to us for supervision. It could be an ankle monitor, it could be several things. So there is ways for those folks to get out, but not by us delivering. And so this, like a validated risk assessment tool, we've had these discussions multiple times over the many years about this exact list, if it should be amended in any way, or
Are there any that you think are
17. I would move that we remove 17 from the list. In 2008, possession of methamphetamine was a felony. It isn't now. In 2008, methamphetamine was perceived as the most dangerous drug in Oklahoma. I don't think anybody in this room thinks that that's true now. If we're going to have I'm certainly not suggesting we add anything, but if we were going to have an excluded possession with intent drug,
fentanyl?
I would be surprised if anybody in the room said anything other than fentanyl. I think it's unfair to exclude possession with intent meth if all the other possession with intents are not exclusionary. Other than, I mean, clearly I'm somewhat biased as a criminal defense lawyer, but the only crime in that list of 21 things that looks significantly different to me than all the others is number 17, possession with intent meth.
Well, I don't disagree with you, actually. Interestingly enough. So, yeah, I hesitate to tweak this list, but that one, I agree with what you're saying. It is a misdemeanor. Part of that is a misdemeanor. Part of that is a felony, but yeah. Changing that list is done by, that list is signed by,
the three county commissioners and the presiding judge.
okay. So ours would be a recommendation to change that, if we want to change it, and then it would go to the BOCC?
I would imagine, yes. Is that right, Commissioner?
I think so.
Right.
We've done these things in concert with the presiding, usually have a meeting beforehand.
Mm-hmm.
And again, I can take the same route as the risk assessment tool if you'd like, and because again, the same types of meetings we've had with this as well. We've formed committees to look at this, and again, it didn't go anywhere. Nothing was changed.
Right.
But I can certainly get with him if that would be helpful to see if there's a route anybody would like to take.
I'd like to form a motion if I could, because I want to make the motion be that you would take this to the people that you've stated and consideration of removing 17.
Okay.
I wouldn't propose that we recommend it from my perspective, but I would propose that we consider, that we offer to the commissioners the consideration of removing 17.
Okay, so just so I'm clear, are you suggesting just to go ahead and just do that and me take it to probably policy and governance and have that discussion to go past that? Or would this be, something we should still follow up with Judge Ogden and get his input prior to. Okay, so I'll get with him prior to, and then,
Yeah, I think you said you had talked to Judge
sure,
Ogden
absolutely,
as you were going to with the other.
absolutely.
That's what I recommend.
Right,
That'd
okay.
be
Well, I'm sure you're willing to talk to him, and I can.
Of course.
Mhm.
So right now I have your motion as, your main motion is to, take this to the people stated for consideration of the removal of 17.
Is there anybody on this board that has a problem with 17? You do? I think it should say.
Yeah, I think it's just that methamphetamine has been dangerous and a killer for many, many, many years, far before fentanyl. It's still one or two uses and you're hooked on it. It's a very serious drug. It stopped most people from going to the pharmacy and getting sinus medicine because they take it and make meth out of it. And so it's a serious drug. It's a serious crime. Now, just the possession of the drug is one thing, but this is distribution, sale of a possession with intent to distribute. That's a felony.
Mhm.
I mean, I think if they're out selling methamphetamine, it's very serious, and it's just, we do have a new drug, more powerful, more serious.
It does say or though, so is there a part of that, you're saying if it was the distribution?
I'm saying the possession of it is a misdemeanor now, is that correct?
Yes.
But the distribution is still a felony.
So
Right, this is all a felony.
Oh, it is?
Rick, you're right.
Okay.
Yeah, I think distribution of any of the big
Yeah,
three,
that's all
you know,
felony.
heroin, any opiates, cocaine-based stuff, all should be an exclusionary thing.
Yeah.
If you're gonna leave methamphetamine in there, take the simple possession out and add of any CDS.
So there's no simple possession, that's possession with intent. I misread it.
Possession with intent, yeah. okay, I
That's
see that
possession
now.
of intent.
What's the difference in distribution, sale, and trafficking?
Wait,
Okay. Yeah, well, anyhow.
Wait for the answer or WEI?
Trafficking about 28 grams. And
Well, how many-
same amount.
how many people in your program do you have that have been arrested for felon in possession of a firearm? A lot?
Quite a few.
That are sent for supervision.
Right.
And like, typically, I mean, is that, because that, a large amount of people get arrested for that here. That's something that I was just curious about.
Those would have to be sent by the judge to us. We don't present that paperwork to the judge.
You don't possess just simple possession of a firearm?
Oh, yes, I'm sorry,
Possession of by
in the
AFC.
commission.
Yeah, in the commission and AFC, because that's what you were asking,
Yeah, that's what I'm
right?
asking.
Yeah.
Simple possession of a firearm after formal conviction.
Yeah, we don't
That's not
find
on
it.
this list.
It's
Right,
not on this list.
yeah, we do.
I think it should be right.
And, okay, so I think I'm clear on next steps.
So is that the intent? I mean, I'm not clear. I mean, what's the scope? What are we thinking about for number 17? Take it out completely or add?
It was just for him to take it to the judges
Oh, the judge.
and see if they want to consider 17. In light of the fact that the other main drugs aren't included, or do they want to include other drugs? They may want to add the other ones on there while they're looking at it. They may say, well, we should have had fentanyl and heroin and et cetera in there.
Because we're still taking off large amounts of methamphetamine and cocaine base off the highway. So,
Yeah,
It's
now
still a problem.
trafficking is still on here. That's
Yeah.
19.
Yeah.
Mm-hmm.
Okay, so the decision is that he's just going to talk to, Judge and who he needs to about, if we want to remove, if that 17 would want to be removed or not.
Just to discuss 17,
Just-
yeah.
Yes, and I'll come back next.
yeah, discussion of, not necessarily remove.
Right, like they may, it just is, it is, as Kent said, it's kind of a one-off there.
Send it over to he's gonna think that we'll make,
That we want it removed.
yeah.
And to me, in my mind, it should be expanded. Not
Maybe we
Yeah,
change,
exactly.
maybe I changed the wording in my motion.
Okay, would you like to, yeah, I can, but if you'd like to change it, you can look at it, it's all.
Okay.
So it says, take this to the people stated for consideration of the removal of 17.
Okay, yes, I'll withdraw that so we can rephrase it to say, instead of consideration of removal, just put consideration of number 17.
So take this to the people stated for consideration.
What do y'all think?
Do you want to limit it to 17? I mean, if you're wanting to add to it, then it's just take it for consideration.
That's what I meant.
If that's what I'm not trying to put words in your
Well,
mouth.
that's what, I just took off of removal, so it just says consideration.
Well, and also, this isn't a judge, this is just a mandatory exclusionary list, so it wouldn't mean, if we took it off, it wouldn't mean a judge, always approves that. It would just mean in scenarios where it's a tiny amount or something, but they're charged with distribution, a judge could consider giving that person, pretrial release. Whereas now you don't even
Right.
if it's a tiny amount, but they're charged with distribution, the judge doesn't consider it at all.
It's right, to put that in perspective as far as, because it's not on the list doesn't mean it's a mandatory, the judge approves it and they move on. For perfect example is for 2023, we discussed this, for conditional bond, 45% of the paperwork we presented to judges were denied release. And 19% of the ORs were denied for pretrial release. So it's not just a mandatory, yes, it's approved. So just so you are aware that, correct, that it's still obviously their choice. That's all I have.
And so is there any,
I'm gonna withdraw that motion altogether, because I see that that's a felony, and I really, when I thought it had simple possession, that was when I made the motion, so I'm gonna withdraw my motion. Okay, yeah.
I don't care.
Again, it gets left,
So, yeah,
like
no
it
action,
was,
no
so
action
be it,
on-
no action, okay.
Yep.
And then any citizen participation? Any board comments? Any new business? I'll accept a motion to adjourn.
Second.
Motion adjourned. Vote, everyone who's in favor,
Aye.
everyone opposed. Motion to adjourn accepted.
Thank you.
That's good.
We're good to go.
140, 145.
Not to throw an additional wrench in things, but this is the only committee I'm a member of. And if we just, by one person, make quorum in that committee, you guys will need to reconsider and do the math on y'all.
We're good for
Okay,
everything else.
I just wanted to make sure
Yes.
before you guys start doing
Yes,
much more.
thank you.
Thanks for coming.
Yep, glad you were
Appreciate
here.
you
Yeah, appreciate it.
very much.
All right, y'all have a great day.
Did you see it?
You too.
Okay, moving on to the mental health board regular meeting, call to order this meeting, roll call, want to introduce yourself?
Kelly Basie.
Brian Mon.
Rick Warren?
Jim Anderson.
Okay, notice of the meeting was properly posted on March 20th, 2024. I'll take a motion for approval of the minutes from December 7th, 2023.
Motion to approve.
Second.
All in favor?
Aye.
All opposed? Okay, motion passes. On to discussion and possible action regarding the election of chairman and vice chairman for 2024.
I move that we vote Bridget Biffle as chairman and Vicky Behena as vice chairman.
Second.
All in favor?
Aye.
All opposed? Okay, passes. Discussion and possible action regarding the report on current AWOL participants.
I did not
Jamie
receive
isn't here,
And I did not receive a report from them.
so we may need to. Should we table it or should we just?
So I put
It's
that on
a
every
recurring
single one, yeah. So it's really just no action.
Okay, no action on that. Discussion and possible action regarding the mental health court budget report.
Same.
Okay,
She's not here on those.
okay, and so number 5 as well, discussion and possible action regarding the report for mental health court, no action on that as well.
Mm-hmm.
And then number 6, discussion and possible action regarding contracting with Diversion Hub for dedicated employees to handle case management for mental health court.
So that was requested by the board. Diversion Hub, I wish she was here to talk about it. I think we probably, Madison, do you want to talk about it for us?
Sure.
Yeah.
We, have
This is
had,
Madison Malone with the, his PD's office. She is the, she's the supervisor of all the diversion for the public defender's office.
I think we have met this objective, so I'm not sure if the board wants to keep it on the agenda. About 2 years ago, we contracted with Diversion Hub, hired Tyler Stark, who's still on the team as a case manager for Dreams Court, though we've renamed them Recovery Navigators. We will add additional positions soon with our 781 budget. We'll add Recovery Navigators through Diversion Hub to the Dreams Court team. But that we have contracted with Diversion Hub to do that already.
Do we want to take any action regarding that?
Definitely strike that.
Second.
Okay, all in favor?
Aye.
All opposed? Okay, number 6 will be stricken. Discussion and possible action regarding implementation of cloud-based software and tracking communication that would aid in tracking and communicating with, increasing accountability, and in providing safe and efficient courtroom alternatives to conducting mass mental health court dockets in Oklahoma County.
If there's no action on that, she's not here.
No action on number 7, and then number 8, discussion and possible action regarding the use of necessary office space for drug court, mental health court, and veterans treatment court.
And where are they now?
So with ICB shutting down for construction, all of our coordinators are housed in one room at Diversion Hub temporarily while they do some updates and repairs to a building they own on the site of their future home. And then they have plan on building out office space for our coordinators in their new space as soon as it's built a few years from now.
Okay, thank you.
And so no action regarding number 8. Is there any citizen participation? Any board comments?
I don't know if what I'm gonna say needs to be board comment or new business. I'd like to tell me Robert's Rule of Order. I would like to introduce our new program director for mental health court. And if that needs to be board comments or new business.
I think that would be board comments because you're not actually taking any potential action on that. Well, they've already been appointed, correct?
Yeah. Just to say that we have in the room Tony McLean, who is going to be our new program director for all of the diversion programs with the new 781 money that's coming in. We are very happy to have him on board. He comes from the business world. We know a lot about recovery. We needed someone who knew a little bit about business. So he's a regional director with Farmers, and he is going to be great at helping us implement the things that we want to implement and get our all of our programs, all 8 of them, in adherence with best practices as is required by our statute. So we want to welcome him today.
Thank you.
Any new business? I'll accept a motion to adjourn.
So moved.
All in favor? All opposed? Motion to adjourn.
I think Butch is on spring break, Kelly, to answer your question.
Okay, good.
For the drug court regular meeting agenda, this meeting is called to order. Roll call, please introduce yourself.
Shirley Basie for the DA's office.
Rick Warren?
Jim Anderson.
Notice of this meeting was properly posted on March 2024. I'll take a motion for approval of minutes from December 7th, 2023. All in favor?
Aye.
All opposed? Motion passes. As to departmental items, discussion and possible action regarding the election of chairman and vice chairman for 2024.
I move that we vote chairman to be Bridget Biffle and vice chairman Vicky Bahena.
Second.
All in favor?
Aye.
All opposed? Motion passes. Discussion and possible action regarding the drug court statistical report.
Good afternoon, everyone. This is going to be more of a year-end review for 2023 since we didn't get to meet in January, so I thought that would be kind of appropriate. And also last time, Mr. Ravitz was asking for kind of a little bit more robust demographic report. The Department of Mental Health has actually added that to their DC web platform now to where we can plug in some statistics. We still got a long ways to go. I know that's where Mr. McLean is definitely going to help increase us in that area. So as far as 2023 goes, we ended with 402 total active participants. We had inactive participants. We ended with 15 doing six-month DOC sanctions. 4 were at our therapeutic work camp, First Step. Inactive in DUI court, we only had 1 female do a 6-month DOC sanction. No males. None of the DUI court participants had to go to First Step. Drug court new pleas. In 2023, we had 152. DUI court had 65. Drug court participants at residential facilities, we had 6 males. DUI court participants, none had to go. You guys are going to see too on the demographic report. Did we get that by any chance? We didn't? Okay.
Yeah.
I can pass that out if we have time. I have copies if everybody wants to see that. Okay.
We need to move to accept this document.
Second.
All in favor?
Aye.
All opposed? Okay, this report is accepted.
All right, thank you for your patience. Moving forward, drug court A1 participants. Again, this was requested that we cut off that after 3 years, we take them off this list. So we ended in 2023 with 73 AWOLs. DUI court, unfortunately, did not have any. Our graduation rate combined for both programs is at 80%. The state grad rate is at 68, so it looks like we're doing really well there. Drug court graduates, in 2023, we had 133 graduates. DUI court had 8. And revocations for drug court, 31. DUI court revocations, none. So moving forward, I could read off this list, but that won't do any of this any good. So I thought if you guys had any questions on the DUI demographic report or the drug court demographic report. If you guys notice, this is an admission report, so this takes a lot of time to build this data. So this is from the year 2021, the start of the year 2021, all the way until January 9th of 2024.
And this is at admission.
This is at admission, yeah. This is the type of population that we're admitting in at admission.
Thank you for this.
See the sheriff clearly picking on the single people.
You know?
Okay.
What was that?
I see that. Look at
Get
that.
married, stay out of trouble.
Drug choice, 78% alcohol. Well, there's your reason for the men, Mr. Warren.
Mhm.
Good call.
If I was to predict if we do this again in 2024, you're gonna see opiates increase quite a bit. So I'd definitely probably put in the 20-25%.
When we look at education, we see 31%, for example, of drug court had a below high school diploma at graduation. Do you know what that number is?
Below, yeah, and I'll bring that back for the next report, but it's typically, it's below 2%. And that also includes people with certifications, cognitive
Oh, I mean at
disabilities.
graduation. So
Yeah,
98% have it.
Yeah, so, sorry, 98% have their graduation.
That's pretty amazing. Thank you.
And then moving on, discussion and possible action regarding the drug court budget report.
That is typically not done by me.
Typically, Mr. Rabbits,
yeah.
did all of those.
We'll have to get those for next time.
So no action on number 4 at this time. And then moving on, discussion and possible action regarding implementation of cloud-based software system that would aid in tracking, communicating, and increasing accountability, and in providing safe and efficient courtroom alternatives to conducting mass drug court dockets in Oklahoma County.
Are we still using Connexus, Mr. Gilbert?
Yes, ma'am.
Okay. I
Yes,
think
we are.
that one's about the Connexus. Anything new with Connexus? Any more uses that we're learning
It
about?
has a lot of functionality, so I would definitely like to see our program be able to tap into that. So I think it can definitely help us a lot. Right now, we're basically using it for a mass texting system to communicate alerts, which is very important. Our lab connects the color code to that as well, so participants kind of have a safety net if they don't call that they're going to get a text message, so they hit test or not test that day.
Does that help the number of people that make it to the test not be missing their test?
It does, and it also helps keep them accountable because now we have proof that they got the text message or not, and they knew that they were informed.
Gotcha. Thank you.
Just real quick, if I can just add a piece onto that, that in the short time I've been here, I've kind of seen that thrown around as like, how do we get more technology friendly? Are we using the services that we're paying for? So one of the goals that I have for very quickly is to actually get with that vendor, have them show us what all it does, and then be able to do a presentation to all the judges and the courts and say, okay, here's what it actually is, what we're paying for. We're using this portion of it, so how can we expand the usage of that to be more efficient in the court system? So that is on my radar, just so everybody knows.
Thank you.
Discussion and possible action regarding the use of necessary office space for drug court and mental health court.
I think we've already heard on that one, so save them for.
Any citizen participation? Any board comments? New business? I'll accept a motion to adjourn.
So moved.
Second.
All in favor?
Aye.
All opposed? Motion to adjourn accepted. And then for Veterans Treatment Court Advisory Board, call to order, roll call, everyone will say their names.
Kelly Basie for the liaisons.
Rick Warren.
Jim Anderson.
Okay, notice that this meeting was properly posted on March 20th, 2024. I'll take a motion for approval of the minutes from December 7th, 2023.
So moved.
Second.
All in favor? All opposed? Okay, motion passes. Discussion and possible action regarding the election of chairman and vice chairman for 2024.
I move that we vote Bridget Biffle as chairman and Vicky Bahena as vice chairman.
Second.
Okay, all in favor? All opposed? Motion passes. Discussion regarding program status report from coordinator.
Good afternoon, everyone. Veterans Treatment Court continues to plug away. We have added 5 veterans since the last report. We've graduated 4, and we've had 1 veteran that was unsuccessful in the previous reporting period. That brings our total of unsuccessful to 3 since we've been operating since July of 2020. When you look back, you see how far from shore you are. You can kind of see the impact that we're able to have here. Just the sheer number of graduates that we have in comparison to those who are unsuccessful. It kind of speaks to, I want to give our team a little bit of a shout out because they're willing to work with these veterans as long as they're willing to put it to work. So, of the 54 current participants, 45 are active. We have 9 that are not. Of those 9, 3 are at 6-month DOC sanction, 1 is in federal custody out of state, 1 is at First Step, and 4 participants are AWOL. Questions?
Motion to accept report.
Second?
All in favor?
Aye.
All opposed? Motion passes. And then discussion and possible action regarding the Veterans Treatment Court budget.
That is a table.
Well, it's on there every time. It's another reoccurring, and it was presented by Mr. Rob.
Yes, same thing.
No action on that at this point. Discussion and possible action regarding creating a website and tracking system for all Oklahoma County veterans diversion programs.
Kyle is using Connexus and uses it really maximally. He uses it for multiple things that in his program. For example, he uses it for the docket. And it has a picture of the defendant on it with their name and all their statistics and things that the court can have really easily in their hands. And then it has their sanction and incentive history so that people can make informed decisions. And so that is also part of the Connexus program that Mr. Gilbert talked about and Mr. McLean. There's a lot of uses for it, like Mr. McLean was saying, that we can use in the future. But Kyle has really tapped into a lot of parts of it that are very, very good for the court. So it's very important that the electronic system has become really something that we just can't live without anymore, considering the volume that we have in this county.
Do we need any action on that this time?
Mm-hmm.
Citizen participation. Board comments.
Just suffice it to say, we miss Mr. Ravitz and thank him for his many years of service on all the above boards.
I second that thought completely. We're glad you're here, and we welcome Bridget Biffle.
Definitely welcome, Bridget.
You don't have to be cranky or loud. You be you. We do miss them though.
We do
But
miss
you
them.
be you. We're glad you're here.
Thank you. Any other new business? Okay, I'll take a motion to adjourn.
Second.
All in favor?
Thank you for this.